Perfect. Thank you so much. Uh, at the outset, I'd like to thank the organizers at AIOC for inviting me to speak on the National Symposium. So I'm going to take you all through some rare eye diseases and an ocular genetics update. So as we know, pediatric ophthalmology deals with varied syndromic, genetic, and inherited conditions. And genetic testing aids in obtaining a confirmatory diagnosis. We now belong to the genomics era, so ocular genetics has gained foothold with advances in gene therapy, especially conditions like inherited retinal disorders or the RP65 LCA. So appropriate genetic counseling is crucial for families. Let's go through some of the cases of rare eye diseases and update on some of these conditions. So the first case is this 2-year-old child called Kirti. She hailed from Northeast India and was referred for bilateral corneal opacities. She was also diagnosed elsewhere with global developmental delay, facial dysmorphism, hypotonia, had non-consanguineous parents. So as we can see in this slide over here, there is a progeroid appearance. So she had very loose and loose skin, sparse hair, wrinkled skin. This is like a 2-year-old. It looks like an old man's photo or old woman's photo. So also there were other features that we can see which are highlighted here. In addition, the patient had congenital dislocation of hips, for which she was given a hip brace, had malformed teeth, posteriorly rotated ears. So what I'm just trying to draw your attention to is we also need to look beyond the eyes for all these extra features that we are able to sort of pick up, and these bilateral corneal opacities. So we here in these cases we think of something like an Ehlers-Danlos or a Cockayne syndrome. So these are the extraocular features that the child had. She had adducted thumbs, pectus excavatum, hyperextensible joints, hip dislocation, and with the genetic testing, we were able to confirm. So this was also done for the parents, and we were able to confirm a PYCR1 gene, which is confirmatory for a progeroid syndrome of DBARC or DBARC syndrome, which is called as the autosomal recessive type 3 cutis laxa. So from the ocular point of view, she underwent corneal transplantation sequentially, one eye after the other, had clear grafts, improved vision, and amblyopia treatment. We also managed to publish this in ophthalmic genetics because it's something really rare. Our next rare eye disease is a child. Try and run this photo if you can look at the ocular motility over here. So see what happens when we're trying to check for abduction. Both eyes tend to converge, so there's a synergistic convergence. There is absolutely no abduction in either eye, both the right as well as the left eye. So this is the 9 position of gaze where there is no abduction. And on primary position, there was a 35 to 40 prism diopters of esotropia on Krimsky test. So this child also underwent nystagmography and an MRI, where on the MRI we can see this butterfly-shaped medulla, which is confirmatory of horizontal gaze palsy and progressive scoliosis, that is the HGPPS. And further, the child underwent genetic testing to confirm a ROBO3 mutation. What's important in this child was that she did not have the scoliosis. And we've seen a series of about 4 or 5 patients who presented to our institute. All of these present with the scoliosis much later in life. So it's mainly the horizontal gaze that comes on first, and they all need systemic evaluation. They all need a genetic testing to be able to prove what exactly is the confirmatory diagnosis, and they need a multidisciplinary approach, so they need to be evaluated by the spine surgeon at regular intervals. So this was her post-medial rectus recession, where she was fairly orthotropic and has a regular follow-up with ophthalmology as well as the orthopedic team. Our next rare eye disease is these 2 siblings. So as you can see, they definitely look syndromic. They have a large skull, they have a hypertelorism, and this boy has extreme ptosis, and both of them present with a very large exotropia. So they had -4 limitation of elevation, adduction, and depression. This extra large exotropia, as you can see, and looks small, something like probably a variant of CFEOM or a CCDD. In addition, the boy had the ptosis. So I'm going to try and run this video of this little girl, where you can see the, other than the ocular, also the child had a lot of skeletal abnormalities, malformed ears as well. So there's limitation of motility in almost all positions. I can run this a little faster and see these real tiny ears that both of them had. Both are extremely short and have dwarfism as well. So they were diagnosed with a TBX15 gene, which is homozygous for cousin syndrome, and the parents are also being tested currently for segregation analysis to confirm the deletion. So the child had surgery for his exotropia as well as dorsofrontal sling to try and clear the pupillary axis because of the poor bells, and they're still under care for further evaluation. After the rare eye diseases, let's move to something which we see very commonly in our clinics. That is albinism, which is a reduced or a reduction of the amount of melanin, and it can be either oculocutaneous, which is autosomal recessive, or ocular albinism, which is X-linked inheritance. And albinism, as we see, exists in all species, right, from the birds, animal kingdom, as well as in humans. These are some children who presented with different abnormal head postures and have albinism and have nystagmus, which drives the abnormal head posture. This is one young boy called Raghavan who actually had colored his hair orange. And I kept thinking, oh, he's some orange variant of albinism, which is later on when they mentioned to me that they have used this hair color. But as we can see, he's got the typical nystagmus, the abnormal head posture, refractive error. The picture on the right showing his arms actually was just to check whether he had any bruising or he was fitting into a Hermansky-Pudlak syndrome, which clinically at least he did not. And what I would, so again, this is the same child who's got all the features of iris transillumination, a blonde fundus, foveal hypoplasia. And what I would like to draw our attention is that there's a lot of phenotypic variation in these OCA or any sort of albinism patients. And we tried to do a study to look at their variations with regards to strabismus, refractive errors, abnormal head posture, as well as their vision and rehabilitative services that may be required, just to try and give families an idea that if you have one albinotic child, the other child may not be that severely or maybe more severely affected. So some of the recent advances that we have is the FDA-approved inhibitor of tyrosine degradation or L-DOPA supplementation, which has been tried in albinism, also the adeno-associated viral vectors. So this was just one area that I wanted to cover in this short span of 8 minutes, but gene therapy has had a lot of advances in these recent years and in the years to come. So I think it's really important that we consider a genotypic diagnosis for all our patients so that we can give them the best possible care. As I said, it's the benchmark for diagnosis and management of most patients with congenital and inherited conditions. There have been advances in ocular genetics in certain areas with more trials underway. So an interdisciplinary approach and teamwork is crucial in managing these cases. Thank you so much for your patient listening. It's my favorite peacock. That's an albinotic peacock, yes.
I've seen how many cases of blepharophimosis syndrome you have seen?
Sorry?
Blepharophimosis syndrome.
Blepharophimosis syndrome. Well, I would say maybe 1 in 2-3 months of blepharophimosis syndrome. It's because it's a tertiary referral hospital, we do tend to see quite a few. Yes.
The modality of treatment is the sling operation.
No, so that would involve a number of surgeries. So it will involve not. Yes.
Due to paucity of time, I think we can have question answers later on. I'll request the next speaker.
I'll get back to you on this.